Okay, looks like we're live. Good morning, everyone. Welcome to our final day of the Washington Poison Center's sixth annual Overdose Awareness Series. It is awesome to get to this final day. It has been a wonderful journey through some really excellent sessions throughout this past month. Folks, if this is the first day you've tuned in and you've not seen me before, not seen the Poison Center before, I welcome you. You'll be able to access the recordings earlier from the earlier sessions as we get all those posted. My name is Alex Sorotsky. I use he, him pronouns. I am a public health educator with the Washington Poison Center. And this truly is one of my favorite parts of the year where I get to focus so much on introducing partners, introducing Washington Poison Center staff who get to share just some excellent expertise with you on all things pertaining to overdose awareness, prevention, harm reduction, and treatment. Now, folks, if you missed last Tuesday, again, not a problem. We're working on those recordings now, but it was just an excellent lineup. We had a session all on rural and urban access to opioid use disorder care throughout Washington. We had a session on revisiting overdose prevention. What does it mean to prevent overdose versus overdose death, and diving into a lot of the nuance there. We had a slightly different session where we didn't rely on a slide deck. We had more of a conversation with one of our partners from Neighborhood House, Johnny. And she walked us through barriers and facilitators for Spanish speakers in Washington and her experience with outreach and education. We then got to hear from guests from the Seattle Public Library who walked us through how their naloxone program got up and running. We focused on some trends in pediatric opioid ingestion and associated factors throughout the state. We had a session all on psilocybin in Oregon, and then we wrapped the day up with unique needs, addiction, overdose prevention, and treatment for LGBTQIA plus youth and adults. Now, a reminder, it is our last day, but there is still time for folks to engage and network and connect to each other through the community tab within the Whova platform. So feel free to peruse what's there, see what questions folks have asked, see what topics and resource hubs folks are gathering there. Feel free to contribute to that by asking another question, posting on a new topic, sharing a resource as well. Now for today's lineup, we got another really excellent lineup. So many of our speakers today are in-house, so many of them are from the Washington Poison Center, whether they've been staff here a while or are quite new. So I'm very excited to go through that lineup. I'll get to a more robust intro for him in a little bit, but our very own Eastern Washington educator Justin Mauger is going to start us off by talking about his experience utilizing experiential learning theory in a lot of our overdose education. We'll have our brand new medical director and chief medical officer, Dr. Colleen Cowdery, walk us through a pretty tough topic, sodium nitrite suicide, and we'll look through some of the trends and data there. We'll have some of our partners from the Washington Department of Health join us and talk about exposure reduction practices for methamphetamine and fentanyl residue. Dr. Cowdery is going to join us again to cover the epidemiology of poisoning. So we're going to talk about overdose data in the news. We're really having her hit the ground running as she's starting with the Washington Poison Center. We'll have one of our excellent pharmacists, Dr. Marlo Murray, discuss nitazines in that next session, and then we will wrap the day up with a discussion featuring our CEO, Dr. Scott Phillips, on resource limitations in rural counties. Now, one nice thing about today, we don't have any simultaneous sessions, so I hope to see all of you and others at every single one of those sessions as your schedule allows. Now, with so many of today's speakers being from the Washington Poison Center itself, I would like to take a moment and remind you all of the Washington Poison Center, of our services. And I think a lot of folks are likely familiar with the Poison Helpline, 1-800-222-1222. On the chance that someone is not familiar with those numbers I just rattled off there, please know that Poison Helpline is a national number you can call at literally any time of day or night. in any poison situation. Give us a call if the person you're calling for, following a potential poisoning exposure, is breathing, responding to you, not having a seizure. We like to say to call us instead of 911 because there's a very, very good chance we can keep you home. About 90% of folks who call us first, we are able to keep at home. And of course, if it is an alarming enough situation, we will say now is the time we think you should get to the hospital or call 911 and get some paramedics on scene. Now, you could call us for medication errors. Say you take a larger dose than you meant to. Say you take a partner's meds by mistake, a dog's medicine by mistake, anything like that. It could be a chemical that spilled on your skin, got in your eyes, got in your nose, fumes you breathed in, a sting or a bite from an insect, anything like that. Give us a call and we'll let you know what to do. Now, again, most folks are likely familiar with that poison helpline, but there's so much more we do outside of the phones. We provide a ton of education like we've been doing for our overdose awareness series, but that's not all we do each year. We do a ton of education and outreach events. We provide a lot of poison prevention and harm reduction trainings to the public in general, as well as to medical providers and medical students. So for folks who are interested in seeing additional Poison Center education, if you've got an event you'd like us to try to be present at, please reach out to us. I'll go ahead and plop that email in the chat box when I am done giving the spiel. But that's at educators@wapc.org. We also use our data, our Poison Center trend data, to help inform us of upcoming substances of concern, of trends we want to pay attention to. And we also coordinate with other poison centers across the country to track those larger trends with different substances. Now, a reminder, we are an independent nonprofit. We're one of the very few poison centers who are an independent nonprofit. With that in mind, our funding is never guaranteed, and there is so much that we do. I'd like to remind you that a contribution to us not only helps keep our phones ringing, but helps us continue to grow and meet the needs of Washingtonians, ultimately saving you and the larger healthcare system a lot of dollars. Now, I also want to elevate awareness of the Mary Selecki Scholarship Fund. This is a newer fund we've been working with. Proceeds to this fund will help public health students who work with the Washington Poison Center. It's actually how I got my start at the Washington Poison Center when I was a public health student. I helped develop a curriculum, and 6 years later, here I am. So we love supporting students when we can, and that additional funding stream could help support additional projects students may have. We've done community needs assessments, curriculum development, curriculum evaluation, internal quality improvement and evaluation, many research projects, and there's so much more we can do with that. All right, I'll get that link in the chat box momentarily. So just some other housekeeping to keep in mind today. Reminder, if this is your first time in this platform, you are all muted. So you can speak all you want, but we won't hear you. So please ask questions as you have them in the chat box. You can use the chat box through the Zoom interface in Whova. You can use the chat box through Whova directly. I'm going to be watching all of them. So please ask questions, share comments as you have them. If you are interested in a certificate of attendance, we will send out a survey after today that's going to be kind of an overview of the full series. We're going to ask a few questions there, one of which will help connect you to certificates. So keep an eye out for that. Now, we've been really lucky this year. We've had some folks who've been helping partner and sponsor this particular year's overdose awareness series. It is my pleasure to once again welcome back Corey Bales, representing the Friends for Life campaign. So, Corey, the floor is yours for a few minutes.
Much, Alex. I appreciate it. Hello, everybody. Again, my name is Corey. I work for DH, a social impact agency based in Spokane and Seattle, as a director of content development. We are a proud sponsor of this overdose awareness series. I had the privilege of presenting on Friends for Life, the campaign I work on. Earlier in the conference series, Alex reminded me, it was actually August 12th. And I am very grateful to be here again today to briefly promote the campaign. So Friends for Life was launched in 2022 in partnership with the Washington State Healthcare Authority. At the time the campaign began, Washington State was seeing a really dramatic increase in opioid overdoses driven by illegal fentanyl and other adulterants in the drug supply. So we created Friends for Life to inform people about what illegal fentanyl is, how it is and has transformed the drug landscape in Washington to be more unpredictable and harmful, how to help teens avoid opioids like fentanyl, how to spot and respond to an overdose, and how to get and use naloxone. Since it began, the campaign has expanded to cover harm reduction information for young adults 18 to 25 and their parents and caregivers, and primary prevention information for youth 12 to 17 and their parents and caregivers. With our most current phase of work, which I presented on a couple weeks ago, we recognized that there was a missing middle between harm reduction and primary prevention. We also knew from our experience on the campaign so far and from data that certain youth and young adults were being disproportionately impacted by this issue. And so, with our most current phase of work, we focused on what we called bridge messaging to reach youth and young adults at higher risk of experiencing an overdose, whether personally or as a friend or bystander. With each phase of work, we create toolkit items that are free and available for download on our website, wafriendsforlife.com. We have printed materials, digital materials, and media like video and audio PSAs. If this campaign sounds of interest to you, I would strongly encourage you to check out our website and take a look at the toolkits. We also offer technical assistance to localize materials with your logo and contact information, custom creative like print ads. We can facilitate the printing process if printing materials is not something that you're familiar with. And we also are happy to give folks access to our video and audio PSAs for local media. Partners across our state have been using the Friends for Life campaign in unique and interesting ways, from movie theater ads to art contests to transit ads at the local ferry stop to local community events. Our strong belief is that while we created this campaign, it belongs to all of you. So if you have any questions or want to talk at more length, my email address is Corey B, and you can see the spelling on my little name below, um, at wearedh.com. Corey B at wearedh.com. And that's it for me. Thank you so much. I'll pass it back to Alex. Appreciate being here once again.
Wonderful. Thank you so much for that, Corey. We'll go ahead and get your email and plug it into the chat box here. So folks, again, please, please, please reach out to Corey with any questions. And I highly encourage you to check out Corey's session from earlier in the series when we get that recording all uploaded there. It was honestly a very inspiring session. And Corey, I don't think I had mentioned this to you after, but on and off later in that day, I was having chats with the education team, the development team, and a lot of your approaches for the Friends for Life campaign was getting us thinking about some additional strategies we might want to use at the Washington Poison Center. So I want to thank you for all of that.
Thank you so much, Alex.
Yeah. Okay, folks, we're going to pivot. It is my pleasure to introduce someone you've likely seen before if you've attended any other session at this year's Overdose Awareness Series. You've seen him moderate, you've seen him introduce many of our speakers. My friend and my colleague, Justin Mauger. Now, Justin was born and raised in Eastern Washington. He holds a bachelor's degree in social work and a master's in international education from the School for International Training Graduate Institute. Justin has experience in a variety of educational settings, from non-formal informational, or excuse me, international education program design to youth programs, teaching abroad, and education administration. He now serves as the community health educator for Central and Eastern Washington with the Washington Poison Center. Justin, take it away.
Great, thanks, Alex. We look good, right? Screen shared and on
Yep,
track with that.
we look great, Justin.
Appreciate that. First, I just want to say a big thanks to my family and my colleagues at the Washington Poison Center. I'm honored to be presenting here today on experiential learning theory and overdose response. I serve as the Poison Center's community health educator for Central and Eastern Washington, as Alex said. The goal for this training is to offer a resource to assist with training designed for experiential learning. I'm sorry, it's a goal for this presentation. This isn't really a training, but from my perspective, it's a presentation. So I want to offer a resource to assist with training design for experiential learning for overdose response and beyond. The Washington Poison Center's naloxone, opioids, and stigma training has been delivered to about 1,700 people in the past year and a half. We'll dive into that program a little bit later, but before I forget, I want to acknowledge the contributions of others to it. So a big thank you to Dr. Scott Phillips, Megan King, Alex Saratsky, Katie Vondro, and Sarah Mahan. And also to all of our community partners who have hosted a training at one point or another. That training has been more successful than I would have imagined, and that's why I'm here today, to share about some of the theory behind it, discuss how to use the theory on which it's built, the evaluation data, and tips for trainers too. My intention is to offer a resource, again, to assist people with training design for experiential learning. It's kind of odd to be lecturing on the experiential learning cycle. I feel like, given this, the limitations of this format, it's necessary evil from my perspective. But it will be posted online for future reference as well. And you can also email educators@wapc.org with follow-up questions or opportunities for collaboration. Contact info will also be on the last slide that'll be up during the Q&A. So the roadmap, where we're going today, I'm going to give you a brief training overview, purpose, goals, and objectives, experiential learning theory, activity design, specifically relating to the Washington Poison Center's naloxone, opioids, and stigma. We'll talk about assessment and some tips for trainers. While this is centered on in-person training, the experiential learning cycle can be used for online training or workshops as well. If a person has questions about that throughout the training or questions about anything else, really, feel free to pop it in the chat at any time. And again, throughout this training, I will reference our training. To be clear, that is the naloxone, opioids, and stigma training, which is the overdose response training from the Washington Poison Center. So looking at training overview, to me, training is like a funnel, right? We have people that go into it and people that come out of it, but they come out a little bit different. That difference is learning. It's what our training facilitates. Along with the participants, we add other things to the mix. There's assessment, like a needs assessment. There's also formative and summative evaluation. There's our purpose, goals, and objectives, the structured activities, as well as the learning theory. We can probably put other things in there as well, maybe the environment, guest speakers. I think honestly, the way the experiential learning works, sometimes the experiences of the participants themselves are in there as well, affecting each other, right? But fundamentally, people are at the center of our programming. This is person-centered programming. So when a person conceptualizes a training, they typically have an idea of what they want to look at or a training topic. They perform a needs assessment, which can take many forms, research, interviews with folks who have lived experience, expert consultation. For me, with our training, I did lit reviews, some key informant interviews, attended other trainings on the subject, and spoke to some of our experts here at the Poison Center as well. Once we understand what we want to change, we understand what the need is, we look at how do we change that, right? I think that developing a robust purpose, goals, and objectives is a great place to start to lay the groundwork or the outline of the training. So I start with the purpose. This is the why. Why are we doing this training? It can be thought as the airplane view, the 30,000 feet above looking down, broad swaths. It's why we are doing what we do. It should be clear and concise though, and it might not be accomplished in one session. The purpose of the naloxone, opioids, and stigma training can be seen on this slide. Reduce the amount of opioid overdose deaths in Washington state. After knowing the purpose, we can look at goals. But really, I just want to bring it back. The purpose, why are we doing an overdose response training, it's because we want to save people's lives, right? That's fundamentally like that's the driver behind this. It's also very much related to the mission of the Poison Center to prevent and reduce harm from poisoning through expertise, education, and collaboration. So purpose is kind of like, for me, it's like the mission statement of the training. Looking at goals, our goals all are going to serve our purpose. For training design, we look at goals. In education anyway, our goals are going to be knowledge, skills, attitude, awareness, and language. It can be a nice little castle, the acronym following that goal number one, or the point under goals, the first one. So again, knowledge, attitude, skills, awareness, and language. Goals do serve the purpose. Goals are achieved within the session. Examples of goals from our overdose response training: increase participants' knowledge of what naloxone and opioids are and how they work in a person's body. So if we increase knowledge of what they are and how they work in the person's body, to me, that's probably reducing one of the barriers to naloxone administration for the lay public, right? So that would be serving our overall purpose, which again is reduce the amount of opioid overdose deaths in Washington state. Moreover, another goal is increase participants' use of person first language. So it's a language goal, right? To me, person first language is a way to address stigma. We talk about stigma in our training as well, and like how public stigma can drive both the macro level or structural stigma, as well as the individual stigma and internalized stigma. So language is really, really key there. And we'll talk about that at some point as well. But increasing person-first language is going to increase access to naloxone. It's going to increase access to treatment because it's reducing stigma. And again, serving our overall purpose of reducing the amount of opioid overdose deaths in Washington state. We come up with other ones too, just examples, like if we wanted to have awareness, like, to increase awareness about the prevalence of overdose in Washington state, right? Trying to get people to buy in, to understand that this is a major crisis, that everybody needs to do their part. We could look at skills, like increased skills in naloxone administration, right? So all these, again, would be serving our purpose. When we look at objectives, we're really just looking at how are we going to achieve our goals, right? So objectives state how you'll meet your goals. They're specific, like very, very specific, and they're also accomplished throughout the trainings. So examples of goals for our overdose awareness training: introduce the Sapir-Whorf hypothesis to the group and facilitate application to real life scenarios. Sapir-Whorf hypothesis is a theory of linguistic relativity. It is talking about how language defines reality. So if we look at our goal of increased participants' use of person-first language, we want person-first rather than problem-first language, because if our reality is that people are problems instead of being people, we're going to treat them as such, and that's really not what we're after, right? Another objective here: facilitate large group discussion on safety of naloxone administration in scenarios with variables of age or size of person, whether they're a relative or a stranger, with or without symptoms of overdose, and look at how appropriate that administration would be. This works into increased participants' knowledge of what naloxone and opioids are and how they work in a person's body, which works into reduce the amount of opioid overdose deaths in Washington state. So we see how it's kind of a three-tiered approach to organizing essentially it's getting from our purpose to our activities, right? Let me know if there's any questions about this. Otherwise, we will move on to experiential learning theory. I already let Alex know if there are any questions or comments or anything in the chat, he can just jump in and interrupt me. It won't bother me at all. So again, if we meet all of our objectives, we'll accomplish our goals. If we accomplish our goals, we'll serve the purpose. And to be clear, these are just two of many objectives for our training. Typically, we see multiple objectives for each goal, right? So to understand experiential learning cycle, we're going to build it together. We're going to start with a processing continuum. So this continuum is one of two axes that makes up the experiential learning cycle. It might not totally make sense what I'm talking about now, but it will in a few minutes. They're used to define a person's learning style. This continuum describes how a learner prefers to process new experiences. So on one side, the continuum ranges from doing, which we'll later learn is called active experimentation. And then the other side is watching, which we'll later learn is reflective observation. And so this is a dialectical relationship, right? There's tension between these two. These are kind of like opposites of each other, and we fit somewhere in the middle. The more of one thing we are, the less of the other we are. Please take a moment to put in the chat where you would fit in this continuum. So if you're a 1, you're like very much like, I just want to get my hands on it and start making something and doing something to learn from it. If you're a 10, you're more like, I want to see somebody do it. I want to see how an expert approaches it before I try it myself. So if you could please do put in the chat what number you are, and we'll come back to that in a second. I'm going to keep talking about it as well. So we'll just Alex, for you, we'll talk about it at the end of this slide, see where people are, okay? The closer to active experimentation or doing a person rates indicates a preference to process information by actively testing ideas and engaging directly in new experiences. They learn best by doing and then seeing the results. The closer to reflective observation or watching a person is, the stronger the preference to process information by thinking deeply, reflecting on experiences, considering different perspectives. They learn best through observation and contemplation. In overdose response training, a person with a strong preference for doing would be concerned with the process of naloxone administration. They would like to handle the nasal applicator, maybe test it out. Well, I have a dummy one. I have a hard time when I see somebody spray one in there. I've seen that in another training before, but they want to handle it, right? They want to get their hands on it and see how it works. Maybe hear a click. They might want to practice filling a syringe. They'll go through the steps of naloxone administration or at least try to, and apply it to the naloxone dummy themselves. Whereas participants with a preference for watching would want to spend considerable time maybe reading the instructions of the naloxone, which would be considerable time if anyone's ever looked at them. They're huge instructions. Perhaps finding an instructional video well before considering application. Furthermore, on this continuum, a 1 would be a very hands-on learner, a person who just wants to try out a new concept. They want to apply it and learn from that experience. A 10 would be someone who is more interested in watching an expert or reading about how naloxone works before trying it out, again, to repeat myself. So most people are not a 1 or 10, although some are. Most people fall somewhere in the middle, right? Personally, I'm probably a little closer to a 3 or 4 than a 7 or 8. Alex, did we get any results? It looks like we got a few, huh?
Yeah, we got quite a few. So I see a 4, 6, 9, 3, 7, 3, 3, 7. That felt like a code, but yeah, lots of no one directly like 5.5 and no one at a 1 or a 10. I'll go ahead and place myself along with the sevens. I see you sevens and maybe 8 on a certain day.
Sure. Excellent. So that's good. And the reason we just did that is the critical point is that I want you all to understand that people learn differently from you, right? You might have a strength in one type of learning, and sometimes as trainers we get, and even presenters, we get in this headspace where like, if I understand it, everyone else will too. But I would say that's fundamentally incorrect. Like, we need to meet people where they are and cater our training design to different learning styles. And the experiential learning cycle gives us a wonderful way of doing that. So we talked about the processing continuum, right? And that's the horizontal line, doing watching. The vertical line is feeling and thinking, right? Again, in the overdose response scenario, people with a strong preference for feeling would learn by talking about their personal experiences with overdose or overdose response, how substance use has affected them or their families. Perhaps a first-person testimonial would be moving for them. They'd be interested in the emotional side of the experience or reinterpretation of past experiences rather than logic and an application of theory. A participant with a preference to thinking would lean into theory. How do naloxone and opioids interact with the central nervous system? How effective is it? What are variables that affect an adequate overdose response framework? If we have people put themselves on this continuum, we would also see variance in answers. Different people learn differently. And again, as a trainer, we want to meet people where they are. So all this comes from this guy, David Kolb, who in 1984 developed this experiential learning theory. Part of it is the experiential learning inventory, which we have a piece of here. Then from that came the experiential learning cycle, right? I want to be really clear also, I hear this a lot, it's experiential, meaning from experience, not experimental, like we're trying untested things on people, right? It's experiential education, it's experiential learning. So the way that Kolb's inventory works is that people rank themselves. Like if you look at the number 1, it says involved, tentative, discriminating, or practical. They put 4 for the one they feel most connected to, 1 for the least, and the other one's in between. They go through the 10 options here. And then total up on the bottom, you see the CE, concrete experience, RO, reflective observation, AC, abstract conceptualization, AE, active experimentation, right? And so this is an inventory that can kind of direct us uh, to show us what kind of learner we are. When the inventory is complete, the inventory taker gets a number for each axis of the experiential, what will become the experiential learning cycle. They connect them and a quadrilateral appears. So here's an example of how one might look, right? This learner would appear to have the greatest preference for thinking and doing. So if we look right down here where my cursor is, you can see that their deepest is on thinking, and then their furthest on one side or the other going horizontally is on the doing, right? So this person, their learning style is really centered on thinking and doing. We would call that a converger. They have a convergent learning style. So a convergent learner's greatest strength, according to Kolb, lies in problem solving, decision making, and the practical application of ideas. So very much thinking and doing. They might focus on a single, most efficient path forward. So if we were to give them this scenario of like, what are the things you can do with a paperclip, right? Their approach might be one of, well, paperclip's used for holding paper together, but perhaps not too many pieces because the paperclip might not work as well, right? They might consider making an experiment where they test out how many sheets a paperclip can handle for themselves, looking at the length of time it will hold a certain quantity of paper before it starts slipping. If different paperclip materials might produce different outcomes. Kolb states that for convergers, their style works best in situations where there's a single correct answer or solution to a question or problem. The style suggests a preference for task accomplishment or productivity rather than for more of a socio-emotional experience. So then if we look at this, opposed to this is the divergent learning style, right? They like to feel and watch. So conversely, a divergent learner is called divergent because they learn best in situations that call for generation of alternative ideas, such as brainstorming exercises. When divergers are presented with a situation to brainstorm, they will thrive. A classic example, again, with a paperclip. They might come up with a paperclip that is made of foam that's 50 feet tall, or the paperclip could be a metaphor for something else, right? There's so many different uses for a paperclip. On divergent thinking, Kolb states its greatest strength lies in imaginative ability and awareness of meaning and values. So then again, in contrast, if we look at the bottom right quadrant here, watch and think, that's the simulator learning style or simulative learning style, right? They might want to look for data regarding experiments with paperclips. They want to watch and think, right? They want to find out how much pressure it's been tested to hold, what materials it's made of, and so on. Kolb says their ideas are valued more for being logically sound and precise than for their practical values. An accommodator, so we're looking at the, again, dialect, the opposition to diagonally opposed to the assimilator. So this is accommodator, they do and feel. They'd want to start by getting their hands on the paperclip, immediately start using it, feeling and exploring the paperclip to find out what manipulations might be possible or impossible with it. Maybe they would bend it to pick a lock or try to make a fish hook out of it, then pick a lock or go fishing. Kolb states the greatest strength of this orientation lies in doing things and carrying out plans and tasks and getting involved in new experiences. The adaptive emphasis of this orientation is on opportunity seeking, risk taking, and action. So again, we saw with our brief poll there that different people have different preferences when it comes to learning. We looked at watching and doing, right? So that plays out with feeling and thinking as well. Given the experiential learning inventory, it's a series of questions that we answer that allow us to come up with coordinates on the axis, and then we connect it to make a quadrilateral. That will inform us what learning style we have, right? It's important to understand, again, that other people have other learning styles, and we have to be aware, especially as trainers, that that's true, that other people do learn differently, and we want to meet them where they're at, right? So as we consider how to involve each learning style in a training, it becomes a four-stage cycle with a concrete experience, an opportunity for reflection, abstract conceptualization, or introducing a theory or framework, and experimentation. So again, CE, concrete experience, we can see that at the top here, reflective observation, abstract conceptualization, and active experimentation. It doesn't really matter so much that you follow the order for these. If you have an idea for a design or a series of activities that does it out of order, that's totally fine. So as a trainer, so we're adding a little bit more onto this now, right? We're adding on the experiencing, publishing, processing, generalizing, and applying. As a trainer, I see this as a cycle. I see this cycle as a way to process data. First, the participants experience something or reinterpret previous experiences, right? Important to understand that it can be a reinterpretation of previous experiences, especially when it comes to overdose response. That was one of the challenges that I really had in that program design. Once they have an experience or reinterpret a previous experience, they publish the data. They show what they know, how they feel, they share their reactions, what surprised them, and so on and so forth. So again, what they're generating in this publishing phase is the data that we're going to process, generalize, and apply through. It's really, really, really important that we take time to allow for the data to be published, right? That personally, like that, it's also the socio-emotional, right? The divergers, feel and watch. It's the hardest one for me. And I have to make a deliberate attempt to really focus on it in a training to make sure that I'm able to complete the cycle with enough data, because I gave enough space in the design and in my delivery for people to publish that data. As we process the data, we either make our own theory or introduce theories and frameworks to assist with making sense of the data, right? So that gets into the assimilators. They really like theories, frameworks, structures that will help them to assimilate that information into their brain, right? We've developed the data, then we've come up with a way of understanding it at this point. We then generalize it to other situations. We come up with at least temporary truths about why things are the way they are. If it works here, will it work over there? Can we generalize our learning to new contexts? Then we try it. So we looked at the convergent learning style, the generalizing, right? And then we're going to try it. We're looking at the applying. We adopt what we have learned into our behavior and apply it to new situations, because we have a new experience where it works or it doesn't work, and the process begins again. And we'll talk a little bit more about that this is really more of a spiral than a circle, right? What I think is really useful, you don't have to be so elaborate with activity design if you don't have time for that, but you can actually just get at the fundamentals of experiential learning through strategic questioning. So we have questions that get into publishing. Well, somebody has a concrete experience, right? Then we want to get them to publish the data. What happened? What surprised you? What did you notice, right? They start talking about that. We get people to converse with each other, get people to challenge each other. We're really trying to get the room to just get everything out there, their knowledge, values, beliefs, attitudes, skills. We want to be able to make an assessment of that. Once we get that out there, we ask, why is it important to know X? How do we make sense of X? What factors guide decision-making for X, right? So this is, again, it's kind of starting to create the person's mind to start thinking of a theory. Why are things the way they are, right? This is the so what. And again, that's processing phase. We then move over to generalizing. So we're looking at how do we take what we've learned here and start trying to consider their possible application to other situations, right? Or other experiences. What's this plugging into? Where will you be able to use this info? What do you still need to work on, right, in order to use it? And then finally, with the applying phase, how will you use these new skills? What will help or hinder you? And what will you do differently next time? So you're getting them to actually start thinking about how they're going to apply it to a specific situation. And just to be clear, there's also questions for the experiencing phase, which are like, what do you feel? What are you aware of as this is happening? Those kinds of things. It's really getting at just having somebody to be present in an experience so that they have something to publish when we move to the publishing phase. So as well as the strategic questioning, we can look at structured activities. What activities can we use to match each process? And so just like there's different preferences with learning, there's going to be different activities that those learning preferences really plug into better. So the publishing, the divergent learners, they're going to like reflective discussions, mind mapping, journal, free write, right? We think of what divergent means, and it means kind of to start in one place and to go into many, right? So with a reflective discussion, mind mapping, or journal and free write, like we're giving people the opportunity to do that. Some people won't be as good at it as others, but it maybe I like personally, I'm not that good at that, right? But it's so important to make sure that we give these learners an opportunity to use their strengths in learning in our trainings, right? Then moving from the divergers, we look at the assimilators. So it's lectures and presentations, expert testimonial, lit review. Again, these are the people that like theory, they like frameworks, they like to ask an expert, hear the expert like explain to them how something works, right? They're very concerned with the theory. How do we, and I think kind of getting into assimilating, how do we fit the data into a theory, right? How do we, that process of assimilation, how do we fit this idea into the frameworks of our brain, right? Looking at the convergers, they might like varied scenario activities. We'll discuss what that looks like a little bit later. Case studies, role play. So again, it's kind of the opposite of the diverger. The converger is taking all these ideas and they're bringing them into one, right? And so case studies are a perfect example of how to tap into that. Same with the scenario activities. Then we're looking at applying. So this could be an experiment lab, simulation, or field work. Just to be clear, simulations are when you walk somebody through an activity, you have an activity planned out that is intended to evoke as close to actually doing something as possible, right? Maybe it's a safer environment, but for instance, like a simulation for overdose response would be somebody using a dummy that is supposed to be overdosed and they're going through the steps of application themselves, right? If you remember my learning style inventory quadrilateral that I had shared earlier, it was deepest in the convergent quadrant, but it touched all the quadrants, right? So again, like how there were a lot of kind of there weren't that many ones or tens, but there were a lot of people kind of in the middle. If we're really after what Kolb describes to be like deep learning, we want to be able to engage all those aspects of a person's learning style while understanding that there's going to be some folks will have a very strong preference to one or the other. Typically, most people have a little bit of everything though. For the Washington Poison Center's training, naloxone, opioids, and stigma, we opt for activities rather than the processing questions. We'll talk about them more in depth, but briefly, we move from watching naloxone administration to a dummy, to a reflective discussion, to presentation and discussion, to a scenarios activity. Finally, culminates in participants guiding naloxone administration through what we call our avatar activity. The final phase also serves as an informal assessment of participant learning for us, right? So again, that reflective observation, we're looking at a reflective discussion. The processing, we're looking at presentation and discussion. Generalizing, we're looking at applying what we've learned to various scenarios. Would it be appropriate to administer naloxone here or not? And then our avatar activity is really application, which is where the participants guide us through it, through naloxone administration, that is. So the experiential learning cycle is really a spiral. It starts when you're born. It stops when you die, as far as we know. It starts with experiencing, reflecting, thinking, and acting, right? So it's that active experimentation, reflective observation, abstract conceptualization, oops, I'm sorry, concrete experience, reflective observation, abstract conceptualization, active experimentation, kind of experiencing, reflecting, thinking, and acting. We take what we learned from the past and we apply it to the future as we move through time, right? So that's kind of what this spiral indicates. People start as a novice, they go to up, they become over time, they become more of an expert at something. What I love about this framework is that I can go and do a training for people that are seasoned social workers that have been working with parents who use substances and children for, years and years and years and years. And they're very, very aware, probably more so than me in a lot of ways, of the milieu of what's going on in these people's lives with overdose and substance use, right? The training works for them because it's drawing from the experience of the people in the room. I can go out to a university that's welcoming all the sorority and fraternity members. Some of these young people are like 18, 19, maybe even 17, but they're living outside of their home for the first time and they haven't been really exposed to much of this at all. They ask them, where do you encounter the opioid overdose crisis? And they say, driving through downtown or something along those lines, right? But not really a lot of personal connection. It'll work for them too. Again, it starts with the experience of the people in the room, and then we build on that and build on that, increasing their proficiency, moving from novice to expert. So I wanted to just mention one other framework that we use. So when David Kolb invented the experiential learning theory in 1984, he drew from other educational philosophers. They're primarily John Dewey, Jean Piaget, and Kurt Lewin. Pictured in this slide is Lewin's change management model. This applies to the Washington Poison Center, naloxone, opioids, and stigma training as well. It's typically applied to organizational change, like say you're in an organization that gets new leadership or something big happens, you have to change focus. The Lewin's change management model is very much utilized in that, but there's no reason that it doesn't work for individuals as well that I've ever found. If you disagree with me, I'd love to hear about it. Shoot me an email. The first step is unfreezing, right? So a person comes into your training, they're frozen in their habits of mind. All of their life experiences have brought them to this point where they come in through that door to the training room and they're set in their behaviors to some extent. So our first job is to unfreeze them, to prepare them to be able to change, right? To break them out of that being frozen, essentially. Unfreezing is to disorient people from the status quo. If what has worked will work, why change, right? So before a change is possible, participants need to be convinced to accept the need for change by pointing out flaws and issues in the status quo. We use the publishing and processing activity for unfreezing in our training. The publishing activity we use is designed to ask questions on which reasonable people may disagree. The facilitator is not correcting people, but taking notes of areas for growth to address in the processing phase. In the processing phase, we have stats and challenges. We illuminate the problem of the opioid overdose crisis. We show people that a change is needed, right? And that we all have a part to play and we can do it. Once participants are unfrozen, we introduce the change we want to see. For our training, naloxone, opioids, and stigma, the latter half of our processing phase introduces the changes we wish to see. For us, we discuss information that naloxone is not harmful, and naloxone can save lives. Attitudes that work against naloxone access and use are often guided by forces of stigma. We work for change by removing barriers to naloxone administration so people can feel safer moving from bystander to lifesaver. And that, when we're talking about the purpose, goals, and objectives, right? The goals are knowledge, skills, attitude, awareness, and language. That's an attitudinal shift, right? Moving from bystander to lifesaver. That for training, that's always the hardest for me. That's always the hardest one because it takes a lot to get somebody's attitude to change on something. But that's certainly an example of what that can look like. So that's the change phase. Looking at the refreeze phase, it's meant through generalizing and applying phases of the experiential learning cycle in our training. In the generalizing phase, participants are imagining scenarios to use naloxone and learning that it's a correct course of action. We're reinforcing the change we wish to see, which is them, again, moving from bystander to lifesaver. Then when they encounter what they suspect may be an opioid overdose, to administer naloxone. Additionally, the avatar activity is an opportunity to reflect upon and implement their learning. So now we'll take a little bit deeper look into our naloxone, opioids, and stigma training. So you can see up at the top here kind of what part of the experiential learning cycle we're on, right? So the experiential learning, the experiencing is the concrete experience. Administer naloxone. These again are the experiencing questions that we have here for people to keep in mind so they have something to publish. What do you need to know? What are your concerns? How do you feel? Right? Participants are asked to consider those questions. And then the facilitator goes through naloxone administration to the dummy. I announce everything I'm going to do, then I do it. Participants will have questions. We note them and then usually cover them later in the process. Every once in a while, I'll address a question at the time, but typically like the questions will be answered during later on in the training, like by design. For our publishing, so again, it's that upper right quadrant, right? The divergent learners. It's that reflective discussion. We have a reflection activity. It's also, I always joke that it's my ability to put a cat into the presentation, which I like. We break the room into continuum with 3 columns. So if you imagine a room, we put signs up that say on one side, disagree, the middle, neutral, on the other side, agree. They become columns and people move throughout the room, determined by whether they agree, feel neutral about, or disagree with a statement. We then ask follow-up questions. Questions move from low to higher risk, from statements that most people agree on to ones where there might not actually be a right answer, right? So that's kind of the process of unfreezing as well. We want to start with low risk so that people are feeling connected and secure and safe, and we don't want to jump right into some of the harder questions, right? Because then people will be more reserved. We want them to open up a little bit. For example, it starts with the opioid overdose crisis affects us all. That's the statement it starts with. So most people agree on that. These days, it seems like in our state, at least, we're like 1 degree of separation from somebody who has been directly affected by an opioid overdose crisis if we haven't been directly affected ourselves, right? From there, it moves to like opioid use as a choice. That's one of the questions that more people disagree about. It's not a question I necessarily have an answer to, but it's a question that when people talk about it, I'm going to hear if they're using stigmatizing terms. I'm going to hear if they have familiarity of what opioids are, how they work, what dependency is, what misuse is, those kinds of things, as well as medicine for opioid use disorder, right? As a trainer, I assess the answers and use it to guide the areas of focus or emphasis in the abstract conceptualization phase. So we move into abstract conceptualization, again, this bottom right quadrant here. It's the processing phase. We talk about stigma. We look at some of the stats. The stigma is also, this is an opportunity from my perspective. We introduce like a framework, which is looking at it from the structural, public, and internal or self levels. And then we also look at these two guys here, Sapir and Whorf, so that theory of linguistic relativity or the Sapir-Whorf hypothesis, how language creates reality, and we discuss person-first language. So it's really playing into the strengths of people that are abstract conceptualizers, right? We're literally like, we're introducing theories, here's how you can make sense of the world around you, and they latch onto that. They enjoy that kind of learning. We look at what opioids are, how they, as well as naloxone, works in the body, look at naloxone, the half-life of naloxone. This half-life was a later slide. As we did our assessments, I was finding that people were forgetting to call 911. So we started talking about re-narcoticization, that somebody can start overdosing again after the naloxone wears off. And so it's like really critical that we get people who are trained in saving lives on the scene to assist with their life-saving technology. We then go to the generalizing phase, which is our scenarios activity. So we read out some scenarios. They read a case, for example, you come home to find the babysitter asleep and your toddler unable to awaken near an empty bottle of codeine cough syrup. Should you administer naloxone? Do you have any concerns? What's an important principle at play here? So we have 6 scenarios. Another example will be that you work in a restaurant, your head chef recently had heart problems, you find them in the walk-in, unresponsive, should you administer naloxone? Typically, all of them, we're having people, like, it's to reinforce that naloxone's not a harmful substance. If somebody's not responsive, it's probably appropriate to administer naloxone. So again, it's taking what they've learned so far, that, like, naloxone is not a harmful substance, and applying it to new situations, right? They're generalizing, they're making generalizations about naloxone. And then we go to the applying phase, which for us is the avatar activity. So we have one person from the group, or the facilitator becomes the avatar for the group, or they're like essentially like the actor. This is purely because it would take too much time. I mean, we've done trainings for groups of like 120 people before, right? If everyone in there were to administer naloxone, that would be 2 hours and 40 minutes, or 240 minutes, sorry, 4 hours, right? Of naloxone administration. Sorry if my math's not correct. I didn't write this down beforehand, but so this is a way to get people to apply the information without having to do it all by themselves, right? It allows for everyone to take part and discuss their learning. It allows for the assessment of the trainer for participant learning, and it should illuminate challenges that became needed alterations for the training. Example, again, is that like people were consistently forgetting to call 911. So I made some adjustments within the training so that we emphasize the need to call 911, and we started to see better results again. And again, just to be clear, with the avatar activity, like we have one person who's the actor, and they're come upon somebody slumped over that's my naloxone dummy, and then the group has to tell them what the next steps are and what the next step is after they complete each step. We discuss it a little bit. So that's how we implement the experiential learning cycle in our trainings. We're going to briefly discuss results. We did do a pre-post assessment for people that was a Likert scale, so that means you rate yourself 1 to 5 on certain statements. We did the first 100 or so participants after we finalized the design, so it was assessed pretty early on. We did 1 or 2 trainings before the design really became final. But once we were like, okay, this is what it is, we very much kept it that way. And that was, so they were assessed pretty early on. It was also anonymous. Like we had people just put identifiers on there, like very much to, if anyone uses Kahoot, like pink unicorn or green soccer ball, something like that. So one of the questions is how confident are you in your ability to administer naloxone properly? The pre was 2.62. It went up to 4.79 out of 5. That was an 83% increase. The mode, I think the mode's really telling for these. The mode was when people started, so that's the most frequently appearing number that people chose in our data set, right? It was one. So most people came into it with pretty novice experience, little confidence in their ability to administer naloxone appropriately, and they got up to 5. How confident are you that you can recognize? Whoops, sorry, next slide. So that was an 83% increase. The next one, how confident are you that you can recognize the signs of opioid overdose? So people started a little bit higher here. They started at 2.8 and they got up to 4.65 out of 5 again. So that was 64% increase. Mode went from 3 to 5 for this one. How likely are you to administer naloxone during what you suspect may be an opioid overdose? So this to me is really where the rubber meets the road. People have the highest starting. They were at 3.37 starting, which I thought was interesting. So people were, even if they weren't confident that they're able to administer it appropriately, they would still try, which I think is really important and speaks to our human condition of wanting to help each other, right? So they went again from 3.37 to 4.81. The mode went from 4 up to 5. So what was really critical for me is that for our modes, all of them ended in 5. We saw double digit, at least like 43%, 64%, 83% increase from pre to post. The final question was just, do you know where to get naloxone? And that got up to 100%. Initially, it was at a 3.37. It doesn't look quite right. Oh, there it goes. A 39% no to 100% yes. So it was an increase of 61%. So just briefly, trips for trainers. This is our final slide, and then we'll open it up to Q&A. So if you have questions, please pop them into the chat. Process is just as important as content. This is like, as somebody who is a proponent of experiential learning, this is really, really an important point to understand. People don't just learn what you say, right? Or the content of a presentation or a lesson, right? But they're learning how they're taught, right? The dynamics we create in our classroom or in our training rooms are reflected in broader society. One of, like, for me, experiential learning is where social justice meets education, right? One of the places anyway. So we want to share power, to humanize, empathize. If I come in and tell people that they don't understand reality and that what I'm telling them is reality, and if they don't pass a test on it later, they will fail, not only is it disengaging, but it's also disempowering, right? Viewing participants as nothing more than receptacles for my information. This is what, in Pedagogy of the Oppressed, Paulo Freire calls the banking system of education. Very standard, historically very standard in our schooling system of education. But I think we're kind of moving past that to some extent now as we get new thoughts and philosophies, teachers into our system. The role of the student, for us, the role of the student and the teacher can shift. As a trainer, I learn from participants in every training. A lot of the knowledge is already in the room. It's my job to unlock it, to create experiences where it can be shared. The philosopher Bell Hooks stated, as a classroom community, our capacity to generate excitement is deeply affected by our interest in one another, in hearing one another's voices, and recognizing one another's presence. I want participants to be excited to implement their learning, right? After one training at a shelter for unhoused people, a participant approached me and said, given such a heavy subject, he thought it would be a struggle from like a real downer, right? Like a Narcan training. Oh boy, this can be, really difficult to get through. But he said it was actually kind of fun, and like, well, maybe fun wasn't the right word. Maybe it's just more engaging, right? I mean, that's really what I'm after. When you engage people, meet them where they're at, like that's an empowering opportunity for them, right? Also, just speaking of learning, I had one of the people in another training. We asked during the publishing activity regarding that opioid use as a choice. People respond to that, and one of the people said, "Well, for me, it wasn't a choice. It was something that my aunties and uncles did. It was something my parents did. It was something all my cousins and my siblings did. It was very much, it wasn't a choice as much as it was a rite of passage." And for me, it was just an extremely powerful takeaway that helped me understand different, a different perspective. And I just, I think giving people the opportunity to also be the teacher for the group, it just really, not only is it share power and models, that, but it also allows for these incredible bits of wisdom to come out. So moving on to fidelity to the experiential learning cycle, you'll find that some aspects of the cycle are more difficult for you to facilitate with your own learning and training style than others. You got to lean into that discomfort, though. That it works. The experiential learning cycle works. Its bones have been largely unchanged for over 40 years. If you use it appropriate, you will be more effective as a trainer. Assessment and reflection are critical actions as a trainer in your training. Always look, listen, feel, pay attention to what's working, not working. Formalize assessment, gather evidence to support your approach. Many people don't. So if you do, one, you're going to have more opportunities, but you're probably like, when you describe your training, you say mine's based on like your evidence. We have an evaluation that supports what we're doing. That's not a claim that everybody can make, right? Also, it allows you, if you see room for growth, don't be afraid to make adjustments to your training, right? The example again with the 911, people forgetting to call 911 and us having to adjust the training in order to really address that so that people started to remember more frequently. Trainer roles. So as a trainer, you have to be what is needed for different people at different times. I've been trained that there are 4 roles. One is the interpreter. So sometimes in a training, you're the interpreter. You're breaking down complex ideas to digestible information and helping people to understand each other, right? Sometimes I catch somebody interpreting for me, like I say something and I'm a verbal processor, so it's not quite all together. And someone says, "It sounds like Justin's saying this," right? I'm like, "Yes, that's exactly what I was saying. Thank you so much." Then everyone, "Oh yeah, I see that," right? So being that role of interpreter and paying attention to that and making sure that everyone's understanding each other, really critical, as well as understanding complex ideas. Sometimes you're a coach, you're giving personalized feedback, motivate, inspire. I do that, really the motivation and inspiration, talking like to destigmatize talking about people as everybody's loved, everybody's somebody's child, somebody's mother, somebody's father, potentially sister, brother. This is who you're helping, right? Sharing sometimes a little bit of personal disclosure too. To understand like how I've been affected by people who have passed on from overdose, I can also allow people to feel motivated and inspired to share their stories, right? Sometimes you're a listener as a trainer, right? Being a listener increases safety and it shares power. Other times you're a director. You maintain the direction, you move the learning along. You have to deal with people like dominators, right? Or deal with it when there's silence. And as a director, you have some clear choices to make in those roles, right? Or in those situations. For silence, I think we have to learn to let silence be sometimes. Sometimes it takes silence to build the pressure for people who don't usually participate to contribute. Sometimes when the quiet people speak up, it's a perspective that isn't often shared and it can be quite profound. So when you ask that question and there's silence, try this sometime. Just let it build. Right. I think that I certainly feel the pressure, and I think other people do too, which is why oftentimes we jump in and try to clarify or change our question in some way. People probably understand. It's just that they're not comfortable to the point where they want to share their answer yet. If you let that silence build, they will eventually. And oftentimes, again, it's the quieter people who take a little bit longer to process information that get to speak up in those situations. And so you get to hear a perspective that's oftentimes not heard. With dominators, I love a couple questions. We'll get to who can answer that in a second. But can we hear from this side of the room? Can we hear from somebody who hasn't spoken yet? If somebody is very much dominating and taking control of the training, you can speak to them one-on-one. Again, like as a coach, essentially. Hey, we need to make sure that we're giving space for other people to participate as well, right? Safety and risk. So how do we establish safety in a training? I think it's really interesting. You can norm, some people norm in their trainings. For me, it's like we have the goals and I ask people, these goals sound good? What other goals are there any other goals you would like to add? So it immediately starts with sharing power. I think we can norm by example as well. But I think getting there early to the space, greeting people, being warm, chatting with them, warming them up too, right? Acknowledging the difficulty of the subject. I never call it a trigger warning, but we give kind of a trigger warning. We say like, different people have different experiences with overdose. If you need to go to the bathroom or if you need to go take a phone call, or if you just need a break because it's a heavy subject, feel free. You don't have to ask permission, that kind of thing, right? You're just establishing safety from the start. You can thank people for answers even when you don't agree. I don't agree with a lot of people a lot of the time, right? But I still thank you for that. I appreciate you sharing, right? So you're still encouraging them to participate. You're creating safety for even, challenging ideas sometimes. And I think that's important to get out there, especially in that publishing phase, right? And again, move from lower risk to higher risk activities, as well as within activities. So a great example of that, again, is in that the converging, the active experimentation phase when we're doing, or I'm sorry, the publishing phase or diverging publishing phase when we're doing our agree, neutral, disagree activity, and we're moving from topics that people typically agree on to ones where there's not really oftentimes not a commonly shared answer among the group. But we want to start with those ones that promote feelings of like belonging, security, and also reflect in our in how we respond to them, like safety, right? Who can answer that? It's my favorite question. If I don't know the answer, I ask who can answer that. And it typically somebody in the room can. I always want to check, and follow up with people in case it might not always be correct. But it is sharing power. It's allowing other people to answer, and it's not guessing, which is really important as well. Another great follow-up question for people: can you be more specific? If somebody makes a general statement and you ask them to be more specific, suddenly it gets really, really deep, really fast, is what I've found. By a show of hands, how many people agree or disagree? Great. Let's hear from the disagree hands. How would someone on the agree side respond to that, right? So it's just basic tips for facilitating a discussion with people. Finally, make the space. Consider the room design with your trainings, whether it's overdose response or anything else. Like, are you going to break into dyads, like groups of 2, or triads, groups of 3? Is it fixed seating? Will there be a group discussion? I personally I really like the horseshoe design, right? So people can see each other and talk to each other. It's not just like one person in the front of the room and everybody in lines looking at each other's backs to the person who has all the power, right? But it's, again, like through our environment, coming up with ways to share power. So happy to take any questions people have. Please reach out to chat about possibilities for collaboration. Here's all my info here. Alex is our Westside educator. He does our training as well. And thank you.
All right, Justin, that was excellent. It's always such a pleasure seeing you like in your element talking about a thing you clearly are very passionate about. All right, folks, please hit us with your questions. We've got, looks like 9 minutes left. While folks are considering their questions, I did see a comment in the chat box. You're a master teacher. Thank you. So some accolades coming your way. I have some of my own kind of comments and questions that we can go through while folks are kind of processing on their own. One,
I just,
oh, please, Justin, go ahead.
Thanks, Mary. I appreciate that. We're also totally available. So if there's ever an opportunity to collaborate, if you have an idea for a training that you want to work with the Poison Center on, we're always happy to, co-brand when possible and work on it together. I mean, we're resources, like the Poison Center is a resource for the state of Washington. So thanks. Thank you also, you're too much.
Yeah, and absolutely, folks. I placed the educators email in the chat box. You see it on Justin's slide here. Please reach out. We love collaborating on trainings. Okay, let me refresh and see if other questions come in. One thing I'll mention is like for folks who may have seen me provide trainings, especially a few years back, my default is lecturing. And I think I'm a pretty solid lecturer, and I've learned quite a bit through like working with Justin and in other contexts, with experiential learning cycle and other things like facilitation is very different from lecturing. And I think like one of the comments you made, Justin, that I always am trying to work on is to sometimes let silence be, because that'll elicit a response from those who may not otherwise respond regularly. And whoo boy, just calling myself out, that is such a learning edge for me to like let that pressure build. With that in mind, Justin, if there are folks on here who are very used to lecturing, maybe less used to facilitating, and less used to considering experiential learning cycle, do you have recommendations on like how they can get started at practicing these very different kinds of engagement?
Sure. And I'll tell you, like, I learned a lot also from you, Alex, like different situations call for different
Right.
skill sets and different approaches, right? And we have to recognize that. I'm at my heart experiential education is absolutely for me, it's like how we're going to make the world a better place, right? But I also have to recognize that that's not always appropriate for every setting. So to get at kind of basic resources, we have a training of trainers program for this training, the naloxone, opioids, and stigma. I think that's a great place to start. Basically, you take the training with us, and then we dive into like why things are the way they are, very much like this, but a little bit deeper on the naloxone, opioids, and stigma slide. Um, and I mean, also just reaching out, like questions, collaboration, that kind of thing is always, I personally, I like to talk about this. I like difficult questions that make me do more research and learn more. There's David Kolb's book, his experiential learning cycle, was initially published in Experiential Learning Experience as a Source of Learning and Development. That's really going to be the ultimate guide for this approach. It's been revised recently as well too, create some more learning styles in it, but the bones of it still are very much the same. Um, so yeah, I will say, like, sometimes I absolutely use like Chat GPT or AI when I'm like, what's a good what activity for reflection am I not thinking of right now? Because as I mentioned, like that reflective observation oftentimes is one of my more difficult learning styles. And you have to be super careful with it. They'll just say brainstorm, right? And like brainstorm can be reflective observation, but there's also brainstorm can be uh active experimentation too, right? So it's more than just picking an activity, but it's really thinking about the intention of it and what you're trying to accomplish. So I would say I think David Kolb's a great place to start. Take the experiential learning inventory, reach out to the Poison Center. If you want to do this training, we're happy to support you on that. Not this training, but our naloxone, opioids, and stigma training.
Perfect. And we got a question in the chat box. How can we sign up for the naloxone train the trainer training? I'm just what Justin said. Reach out to us, send us an email, and we'll begin scheduling and coordinating, kind of figure out the logistics for that. So I love it when folks want to learn more. I'm going to elevate a comment to you, Justin, just in the chat box. Someone saying, I give this kind of education and it is very lecture based, so this has been hugely informative on ways to make the experience more interactive.
Good.
Oh, go ahead, Justin.
Oh, thanks. Yeah,
Yeah.
that's my goal, right? I think that I'm very much not like I don't learn well in a lecture, and it's I also wonder, like, with our entire like formal schooling system, at least when I was a kid, it was really lecture based as well, right? And I saw a lot of people that I knew like kind of slowly drop out, and not continue on with their education. It wasn't until I really got to college, and specifically like master's degree level, where I was like really, really, really engaged with the content, and so I wonder, like, if we were to make everything a little bit more interactive, how it would change, how it would change our society, like as far as education. Would it keep these people in school, give them more choices in life, things like that? So thanks, I appreciate that, and I'm glad that Lisa, I'm glad you're considering that. Yeah.
And then Julie, to your comment, yes, reach out to us and we can work on setting up that training of trainers. Um, one thing you mentioned, Justin, too, was on like how you and I, as well as other folks with the Poison Center, have like collaborated on this. And I think I'm just thinking through to like how this training has grown from the very first idea of it to where it is now. And so much of that, like, of course, has been altering it depending on like how a given you want it, some of the earlier sessions went, but I think so much of it has been collaboration. And like for folks who you'd see what I think is a very fun experience if you were a fly on the wall in one of our like educator like curriculum meetings, because it's a lot of Justin and I being like, well, how about this? Well, how would it apply here? And it's the back and forth, especially because Justin and I as individuals can have some pretty different like learning styles and learning approaches. It gives us a more like holistic approach to something. And so I'm just echoing one of your earlier comments, Justin, of like collaborate wherever you can, for folks who are working on curriculum design, on building new trainings, updating old ones, because I think that's given not just this training that Justin's been referencing more depth, but our so many of our other trainings and curricula we've been revisiting with this all of this in mind.
Yeah.
All right. Well, we have 1 minute left. I'm not seeing any additional questions or comments. So, Justin, is there any, final ask of attendees here you'd like to leave us with?
Really just reach out and collaborate. I think hopefully this will be a reference for folks. Like we'll have it posted online at some point in the future. And so if you want to, as one of the participants mentioned, think about how to make your trainings more interactive. Great. I also feel a little bit like though sometimes like it's just enough knowledge to be dangerous kind of thing, which is why we're available. Like we'd love to chat with people and even I love reviewing training design. It makes I'll totally steal your ideas and give you some of my ideas to steal as well. And I think it makes everybody better. So just always know that you can reach out to us and we're available to chat. So thank you. Yeah, appreciate it. And thanks for coming today. Good to see everyone.
Excellent. Thank you so much, Justin. That was a really great way to round this off. That folks, we want these sessions to be the beginnings of dialogues, not the ends of dialogue. So please keep the dialogue going. I'm already seeing an email to us talking about getting a training going. So excellent. I love seeing that. All right, folks, we're going to go ahead and wrap this up. Please join us in 15 minutes at 10:30 for our next session. Hope to see you all there. Thank you again, Justin. Take care, everyone.
Thank you.